member of Osstem ISC educational team in Switzerland. Today's topic is, why am I using Osstem? So I did not always use Osstem. Before, I used different implant brands. Of course, Straumann is a market leader here in Switzerland. I also lived and worked in Brazil, where I used the brands Conexão and Neodent. Back to Switzerland, I used Camlock from Germany. It's also a popular system here in Switzerland. I used a little bit Astra, is situated close to here in Switzerland. Biodenta, not so very well known, and a lot of Noble Biocare implants. So I had experience with different brands. I was not unhappy, but I tried out something new. I was Osstem. And why I did this? For me, the main reason was the design and the innovations. I saw some pictures. This time I was regularly looking at all different implant brands, what is coming out, what attracts me. And so I really liked this time the design of the bone level implants. What are the advantages of Osstem compared to other brands? In my opinion, there are some advantages: the portfolio, the research and development, the education, price value, and the philosophy of DIY, do implants yourself. So let's get to these points. The portfolio compared to other brands is that Osstem has a solution for almost every clinical problem. They also deliver scanner software, milling machine, just the whole line what you need for do modern implantology. And because they do it themselves, the products, they fit together, which I have seen some compatibility problems with other brands. So Osstem is a total dental provider. Then they have really a great research and development compartment. They bring out a lot of innovations, but they don't just bring it on the market, they really test it, and when they're ready, they bring it to the market. And they're very intelligent solutions. So they have a great staff of different professors, teachers, dentists, and it's fantastic to see the new products. And in my opinion, they invest in the right part. It is the digital dentistry, and they call themselves leader in digital dentistry, and I think this is true. And then it is also just a company philosophy. The former CEO, Dr. Cho himself, he is a dentist, and this just has a big influence of the whole company philosophy. Here on the right side is a very short video with an implant. It's something new. It is a very nice surface. It's hydrophilic, and when the implant touches the blood, you can see here how the blood is on the implant surface. So it's very hydrophilic, and healing time and so on is faster and better. So really great new products. Then another advantage may be the education. There's a lot of education, mainly community in Europe as well. So there's a master program, then there's a global symposium, European symposium, online courses like this small course, local courses in every country, And there's a lot of research and a lot of published literature. There's over 3 million of published pages. And it's really nice also. So this is a short video of our courses we do regularly in Switzerland. We held about more or less every month a course how to use the product. So it's not just that you get a product, you always can have the special education for this specific product, and so you really can have success. And then price value is great. When I switched to Osstem, this was not the main reason. I used more expensive brands, and it was not a big problem for our patients. But nowadays, I think it is really an advantage. By example, prices can vary from country to country, but these are the prices about in Switzerland. And when I put an implant, but I put this with a fully guided surgical guide. So the price of the implant together with the guide is, by example, the price of a Nobel or Straumann implant in Switzerland. So for the same price, it's not that it's cheaper, it's just that the patient gets more value. That is really, really great. And then the philosophy, do implants yourself. I don't know all the countries, but there is a big difference compared Switzerland to Korea. In Korea, about 80% of all the dentists, they place implant, and in Switzerland, it's only 20%. This doesn't have to be good or bad, but it shows a little bit the philosophy is that the system is easy. With educational and training program, everybody is able to place the star better, or Swiss dentists are take more care or whatever. It is the philosophy how to develop the surgical cassette to have good, easy protocols to have success. This is an example. Is a doctor in Bern, and she was this time using Osstem for 1.5 years. She did not have a lot of experience, but look what she's able to do after this short period of training. She's doing fully guided sinus lift, and she was also doing all on 4 cases. So really great development in a very short time. And this is the reason of the very logical and easy to use surgical kits. Or here, another case from our office. This is a former employee dentist of our office. And this was the first case she has done with surgical guide and with the lateral sinus kit. It's called LAS kit. So she had to extract this tooth number 17. She made a filling on tooth number 18, and then she did an external sinus lift, and she placed 2 implants, position 17 and 16, I think in almost a perfect position. And this is not so easy, especially when you know other surgical guide is sometimes impossible to place implants on tooth number 7 because you don't have the space. And by example, great innovation from Osstem in this surgical guide, which is not using sleeves. You can go in laterally with your drill, and you are able to place implants without any problem in tooth position number 7. So really great. Of course, it's possible to achieve these results also freehand. But for me, by example, as a practice owner, it's very important to have a quality control, that everybody is following the philosophy, and the system with guided surgery is just great to achieve a good quality. What does it mean in daily life for myself? I am able to do more implants and to do implants better, faster and cheaper. So this is for me the main advantage. This is an actual case. I placed 6 implants and I did a bilateral internal sinus lift, everything full guided, and the whole surgery from saying hello to the patients to goodbye was 75 minutes. And the patient did not suffer a lot of pain after. So she came back and she said, "Oh, doctor, you have the golden hands." But of course I have not. It's just because the system helps me to do good and fast implants. And maybe it was also a little bit of because of the good sedation, good drugs that the patient received. Okay, so this is the main reason why I use Osstem, and I can really recommend you to give a try, and it's great. Thank you very much for your kind attention. Bye.